Hello, this is Dr. Stanley Lang, and welcome to this video. The subject of this video is peripheral neuropathy. So if you have peripheral neuropathy, this is something that I encourage you to pay close attention to, because for most people who have this condition, they have lots of suffering and not a lot of hope for healing. Now, there are treatments that are available to control the symptoms of this condition, this peripheral neuropathy, but unfortunately, there's not a lot of treatments to heal the problem. So I want to tell you a story about a patient that I've been seeing who is benefiting from a new treatment that is available in some places around the country. And so if you have access to one of those places, I encourage you to to try to find out whether the practitioner is familiar with treating this condition. So peripheral neuropathy is where the nerves are damaged that are away from the brain. Particularly, we're usually talking about what we call the sensory nerves. It can involve what we call the motor nerves. Obviously, those are the nerves that affect the muscles. And in many cases, it's both. They have both a sensory and a motor neuropathy. Now, and a lot of times we don't know for sure why a person is having neuropathy. Sometimes a lot of times doctors are guessing at the reason. We know that most diabetics develop a neuropathy because of the high blood sugars and other things that are going on that are very, very pro-inflammatory to those poor nerves. And so they eventually get damaged, and in some cases they actually die. Before they completely die off, though, they start signaling all sorts of things that are pain and other symptoms that drive the patient crazy because they can't get away from it. It's there with them all the time. And in this case, this patient had an unusually very thorough diagnostic process to figure out why he was having this peripheral neuropathy, including evaluation at one of the major tertiary care centers in the country. And at this place, he actually had a biopsy of his nerves done, and he had the conclusion which is usually found, which is, we don't know. It's so-called idiopathic. And unfortunately, when that's the case, there's nothing that you can do that can actually heal the nerves in traditional medical practice. So in this case, though, we have instituted what is a new treatment available, at least in a few places around the country, that is called shockwave therapy, using the stem wave technology. Now, I'm not going to go into a lot of detail, just to say we chose stem wave because we thought it was the best of the shockwave options to offer to our patients. Now, in this particular case, the patient's neuropathy had progressed to the point that he couldn't feel his feet anymore. So obviously, if you can't feel your feet, except for pain, all he could feel was pain when he walked on his feet, but he couldn't feel anything else, just pain. And when your only signal is, I feel pain, that's not a very good balance signal, and so his balance was getting progressively worse. He was falling frequently. There are a lot of other things that were going on as a result of his neuropathy. So we started to use this technology, the stem wave shockwave treatment on the bottom of his feet, which is where most of his neuropathy is going on. And after only 4 treatments, he's already had a dramatic decrease in symptoms that are distracting him. But more importantly to me, today on the 5th follow-up evaluation, he was having sensation returning that actually tells him where his feet are in space. He can feel his feet and not feel like they're somewhere else. He can have better balance because he can feel his feet. His feet don't feel like he needs to fidget all the time to distract him from the symptoms. And this kind of return of nerve function after only 4 treatments, I consider very dramatic. And I'm sharing this video so that you can have hope that this possibility exists for you also if you have peripheral neuropathy. Now, within StemWave, there are a lot of doctors who've been treating these conditions for many years. They have a lot of experience. On average, I would say on average, the typical patient is going to need somewhere between 8 and 15 treatments based on the experience of these various doctors who have been treating peripheral neuropathy patients. In this case, this patient is already having significant experience improvement in 4 treatments. Now, he actually had a complete elimination of his pain after 1 treatment. So when he first started, he was feeling like he was walking on rocks, and that was his only sensation, which is not a very enjoyable sensation, as you might imagine. That sensation went away, and since then he's getting these other symptoms that indicate that he's starting to feel things normally again. So shockwave therapy is proven to have significant healing effect on multiple tissues, including the nerves. The StemWave version of shockwave I consider the best available in the country at the current time, which is what I'd recommend that you pursue if it's available to you. There are several companies that pretend and use the term shockwave when it's actually not shockwave. There are a couple of companies that actually have true shockwave therapy, and I'm not going to go into details, just to say if you can find a StemWave provider, I encourage you to find one. And to seek help for your peripheral neuropathy. Now, there's several other things that we're doing that I'm not going to go into lots of detail, but just to say it's important to pay attention to things like the diet. Is it a pro-inflammatory diet or an anti-inflammatory diet? Are the biomechanics being attended to? Things, in other words, are you doing things that make things worse or make things better in terms of how you walk? There's a lot of other things to pay attention to, and there are much more sophisticated, multifaceted anti-neuropathy programs available. But what I want to point out is that the shockwave alone is helping this person to heal. The shockwave alone is helping this person to heal, along with the biomechanical changes that we've made in how he walks. So I hope you found this hopeful if you've got peripheral neuropathy. If you've got chronic pain, the same thing applies, only it happens faster for about 85% of people who have chronic pain. So I encourage you to seek somebody who can provide this service if you do have either chronic pain in general or peripheral neuropathy specifically. Hope you found this helpful. God bless and have a great day.